Tuberculosis caused by the bacterium Mycobacterium tuberculosis has existed for thousands of years. By the late 19th century, as European colonization expanded in South Africa, the region began to experience its first significant encounters with the disease. The arrival of settlers and the subsequent urbanization laid the groundwork for TB to take hold. The discovery of diamonds in 1867 and gold in the 1880s transformed South Africa's economy and social structure. The expanding mining industry drew thousands of laborers from various regions, creating a demographic shift. This influx led to the overcrowding living conditions in mining towns, where sanitization was poor and healthcare was virtually non-existent. These factors created an ideal environment for the spread of TB. The colonial administration's policies during the 19th and early 20th centuries contributed to health inequalities. Access to healthcare was limited for black South Africans, while white populations had better medical facilities. This disparity in healthcare access heightened the impact of TB among marginalized communities. With the establishment of apartheid in 1948, systemic inequalities intensified. The apartheid regime enforced segregation, resulting in inadequate living conditions, malnutrition, and limited healthcare access for black populations. TB flourished in these environments, and by the 1980s, it was clear that the disease was a major public health crisis, particularly among those living in impoverished townships. In the late 20th century, the emergence of HIV epidemic compounded the TB crisis. South Africa faced one of the world's highest rates of HIV infections, which significantly increased the risk of developing active TB. The co-infection of TB and HIV created a dual epidemic, straining the already fragile healthcare system. In response to the growing TB burden, the South African government and various organizations began implementing public health strategies in the late 1990s. The introduction of the directly observed treatment aimed to improve TB treatment adherence and outcomes. Additionally, integrated approaches targeting both TB and HIV were developed to address the dual epidemic. Today, South Africa continues to wrestle with high TB rates, reporting over 300,000 cases annually. The emergence of drug-resistant TB presents an ongoing challenge. However, recent efforts to enhance diagnostics, treatment access, and community education are paving way for a more comprehensive approach to tackling TB. The history of tuberculosis in South Africa is a complex narrative shaped by migration, socio-economic factors, and systemic inequalities. Understanding this historical context is crucial for addressing the current challenges and improving public health outcomes.